I was hospitalized for a long time as a child with a chronic medical condition, and I had one specific nurse practitioner that took excellent care of me, and she made a real impact on me. And I decided that that's what I wanted to be when I grew up. My specialty is kidney medicine. I see 70% patients on dialysis and about 30% of patients I see in chronic kidney disease clinic. They are being treated for kidney failure. And some of them are waiting for kidney transplant. The biggest thing that we go over in our first visit is their lab work, because a lot of patients see their reports, they know what their reports are, but they don't know what any of that lab work means. So my first initial appointment is to see what they understand and then fill in any gaps for what they don't understand. If they're progressing and they've not deemed kidney failure, then we're just monitoring their chronic kidney disease, trying to prevent it from progressing any further. If they've progressed to needing dialysis, then we'll manage them in the outpatient dialysis units. One of my areas of specialty, though, is managing patients who are waiting for kidney transplant. When a patient is deemed end-stage renal disease, then we set them up with the transplant coordinators, get them ready for what their visits look like. And oftentimes they're left with a laundry list of things that they have to accomplish to get them ready for transplant. And I try and fill in those gaps for what appointment is next, what's the next thing on the agenda that you have to accomplish to get ready for transplant. And if obesity is an obstacle for you, then I'm more than willing to work with you on all of the aspects of how we can accomplish getting that out of the way as a barrier. I focus on their chronic kidney disease as a disease, and then tailor their obesity to the medications that we would put them on. We also focus on diet, exercise, stress, and put it together so that way it's not just one thing that we're focusing on all of it. Compassionate care, that's my biggest thing. I want somebody to walk away and feel like I was empathetic to them and I was supporting them and really trying to not just see them as their lab work, but as the whole person.